begin with the tightening grip of the coronavirus. In just a matter of weeks, Omicron is now the nation's dominant strain. It accounts for 73% of all new COVID cases in the country. The highly contagious strain was first reported in the U.S. earlier this month, and now it's being reported in all 48 of all 50 states across the country. Omicron's rapid takeover is causing concern ahead of the holidays. It has people lining for blocks to get tested. A new government-backed study out of Columbia University suggests Omicron is 36.5% more transmissible than the Delta variant. The Biden administration is once again taking additional action to combat the virus as this new wave of cases sweeps the nation. CBS News' Natalie Brand has more.
President Biden is laying out a stepped-up strategy to help battle the Omicron surge, now the dominant variant in the United States.
This is not a speech about locking the country down. This is a speech outlining and being direct and clear with the American people about the benefits of being vaccinated, the steps we're going to take to increase access and to increase testing, and the risks posed to unvaccinated individuals.
The White House is announcing it will increase pop-up vaccination sites, add federal testing sites, purchase 500 million at-home rapid tests to send to Americans for free starting in January, and it will deploy additional troops to help overwhelmed hospitals.
It's the unvaccinated people who are the most vulnerable not only to getting infected, but to getting a serious outcome.
With the pandemic impacting yet another holiday season, the administration's health experts say family gatherings can be safe if individuals are vaccinated and boosted and take other precautionary measures, such as testing and wearing masks around strangers. Dr. Anthony Fauci also notes there could be a silver lining ahead.
We're hoping that when we get through this Omicron wave, that we will have enough people vaccinated and or having been infected and recovered well, that there will be a degree of immunity in the community such that you don't have a situation where it's dominating your life.
But for now, cities including Washington, D.C. are reinstating mask mandates. Los Angeles has canceled its in-person New Year's Eve celebrations, and New York is debating whether or not to have its Times Square ball drop. Natalie Brand, CBS News, the White House.
Thank you, Natalie. Dr. Len Horovitz joins us now for more on this. He's a pulmonary specialist at Lenox Hill Hospital in New York City. Dr. Horovitz, thank you for joining us. First of all, we're just 4 days away from Christmas. For many people, testing is a huge factor in deciding whether or not to gather with their family and friends. What do people need to know about how far out they should be testing and how often?
Testing is a snapshot of your status that particular day. So the utility of testing would really ideally be daily testing, PCR testing being the most sensitive, but an antigen test being adequate if it's done day by day by day, because you may miss a day where you're not infectious, but the following day you may be. So testing the day of an event, the day before an event, testing as often as possible, and that will be possible in January. This is the most important thing to know about testing. It has to be multiple times and sequential.
So make sure you have a snapshot of that day. We're seeing long lines, long testing lines in cities across the country. The Biden administration is going to send out free at-home testing kits for those people who ask them. But what do we need to know about them? Is there a concern about accuracy? I've heard that many times. I've taken them myself and wondered, is this accurate? And also, do they test for Omicron?
These antigen tests are not as sensitive as PCR, but they do have great utility, especially when done day by day. They don't test in particular for Omicron, but I think we could almost assume that since Omicron is the dominant strain right now, it will be Omicron that will show positivity.
That being the case, do you foresee the federal government perhaps helping people get access to those PCR tests that are quick, the ones that you could get same day? Those are pretty expensive.
They're expensive and there is a wait time. There is apparently some huge amount of money that will be spent in January for testing, both antigen testing for people at home and PCR testing that can be done at pop-up sites around the cities and in districts where testing is important.
Right. So what's the best course of action to take if you are fully vaccinated and happen to be exposed to someone who tested positive during the holidays, during New Year's, at some of those family gatherings?
Well, of course, we're talking about vaccinated people and ideally boosted people. Vaccination is your best defense. If you're exposed to someone, the following day you may not be positive, so it's important to know that you've got to wait 2 or 3, probably 4 days before you'd have a positive test. Even 5 days it may take in some cases to have a positive test by an antigen test, which is less sensitive. So know when you're exposed and then calculate 2 or 3 days after that to do your first test.
But continue testing well into perhaps the 5th day.
Absolutely.
Which is not an option for people now since we're only 4 days away from Christmas. Breakthrough cases are skyrocketing as Omicron spreads in the U.S. Is the reality that vaccines may not be able to fully prevent us from getting infected, that they may only protect us from being hospitalized or dying, of course? And do you think it's inevitable that everybody in the U.S. is going to, or most of us, is going to be at some point exposed to the virus?
Well, let's go backwards. Yes, I think everybody's going to be exposed to the virus. It's a matter of what precautions you take. Vaccination and boosting will, of course, eliminate the possibility of hospitalization and death, and that is no small matter. A breakthrough case that's mild or flu-like is something that we all used to tolerate in the old days when the average adult got 2 or 3 colds a year. If that's the case, that will add to natural immunity to COVID in general, and that's not a terrible thing. The vaccinations that don't protect us are ones like Johnson & Johnson and vaccines that are made in other countries. The AstraZeneca, for instance, does not have a lot of protection against Omicron. So Pfizer and Moderna are your best bets for protection, and a booster is, of course, the best idea you can have.
That is a harsh reality. Dr. Len Horovitz, thank you so much for joining us.